Hello, this video provides an overview of how to develop a search strategy for a systematic review. To begin, there are a couple of resources that you can refer to for more detailed information. The first is a 2018 article by Bramer et al. Bramer is a biomedical information specialist, a librarian, that specializes in and has published research on how to conduct both thorough and efficient systematic literature searches for systematic reviews. This article outlines their approach to developing a systematic review search, and it will be the basis for the content in this video. The second resource is a self-paced module by Cochrane, a leading organization in the world of systematic reviews. Module number 3 in the online course, Conducting an Intervention Review, focuses on developing a systematic and comprehensive literature search, and you can access it for free by registering for a free account with access provided by Case Western Reserve University. As a reminder, a systematic review aims to collate all empirical evidence that fits pre-specified eligibility criteria in order to answer a specific research question. It uses explicit systematic methods that are selected with a view to minimizing bias, thus providing more reliable findings from which conclusions can be drawn and decisions made. Not only are articles screened by the team in a systematic manner, the way the search is performed in databases is also done systematically. The reason is because the search is the first opportunity for selection bias to creep in. If the team isn't meticulous at the search stage, they might unknowingly exclude relevant articles through the literature search itself, and this would affect the entire process that follows. This graphic shows where the search process falls within the entire systematic review methodology. The search would be performed after the team has written the protocol and before articles are evaluated and selected for inclusion. To minimize bias in the search process, the team will document the entire decision-making process related to the search to ensure that it can be described in the final paper and so that it's reproducible. They'll also create a search strategy that includes all relevant search terms, including both natural language terms and controlled vocabulary. Controlled vocabularies are thesaurus terms unique to a specific database. For example, PubMed uses controlled vocabulary called medical subject headings, or MESH terms for short. The team, or information professional on the team, will combine search terms in a conceptually logical manner. Most databases allow users to combine search terms using Boolean logic. The team will also plan to search multiple databases that likely have relevant information sources. The reason it's necessary to search multiple databases is because they each have differing levels of literature coverage on any given subject. Minimizing bias also includes adjusting the search strategy using syntax specifically used by selected databases. This is a partial example of a systematic review search strategy as published in the 2022 article, Drug Checking Services for People Who Use Drugs, a Systematic Review, in the journal Addiction. There are multiple approaches to reporting the search strategy. This example shows one method where each search term along with database-specific syntax is included on each line separately. This is only a small portion of the entire search strategy. The full strategy is 10 pages long and includes adjusted searches for 7 databases. Find the article's supplemental files to view the entire research strategy for the systematic review. These 15 steps of developing a systematic review search are described in the 2018 Bramer article. Here, the first 4 steps focus on getting clear on what your research question is and identifying the most essential concepts that all articles we hope to find should discuss. There are a few tools that can help you develop a great research question. One is the PICO framework. PICO stands for Population, Intervention, Comparison, and Outcomes. There are other variations of PICO and several other frameworks that exist. You can Google them for more information. These tools are also very helpful for identifying essential concepts to search for. After you've developed your research question, with your research team, you will ultimately want to develop a comprehensive list of essential concepts and then identify all relevant natural language terms and controlled vocabulary terms, like the list shown here. To begin developing this list, you will start identifying essential concepts. For the purposes of this video, concepts refer to ideas that can usually be expressed using a variety of search terms. This example table is a good starting point. However, it does not yet include a comprehensive list of search terms. It's critical to take note of your search terms throughout the process so that you'll be able to accurately report them in your final publication. However, it also helps the team stay organized as you work on a systematic review over many months. Using a spreadsheet is typically very helpful, and you can see that we organize them where distinct concepts or ideas are separated in columns. Synonyms and related terms are listed in the rows below. In addition to the PICO framework, another tool comes from the Bramer article. This figure shows how to prioritize concepts and identify ones that are essential to the search. Bramer et al. Say that the search strategy might not include all concepts found in the research question. You might look for articles that discuss a particular outcome, for example. However, some concepts might not be useful for the literature search itself. Outcome-related search terms are often excluded in a systematic review search because it often excludes articles with null results. Additionally, Bramer et al. Explained that some concepts may unnecessarily complicate or restrict a search strategy, leading to missing articles that are relevant. So here in this figure, your top priority concepts for the search are ones that are both specific and important to your research question. Terms that are both more general and less important are less important for the search itself. Specific terms objectively return less search results if you were to search for them by themselves. General terms objectively return more search results. One way to evaluate the importance of a concept is to ask, should all articles I intend to find mention something about this particular concept? If so, it should be evaluated as more important. If not, it's less important or not important at all. A similar question to consider is, can I imagine highly relevant articles that do not mention this concept or idea? An example of a specific search term could be something like Area Deprivation Index Tool. Here in PubMed, a search for Area Deprivation Index Tool returns 176 results. An example of a general term could be something like the word cancer. Here in PubMed, a search for the word cancer returns over 5 million articles. This is what Bramer et al. Mean when they describe terms as specific or general. If we look at the vertical line, determining the importance of a concept is subjective and depends on the research question. There are many useful ways to identify search terms, and information professionals use multiple. You can speak with your colleagues, other subject experts, to help you identify terms. You can skim titles, abstracts, and author-supplied keywords of relevant articles to identify terms. And you can also find out how a particular database categorizes relevant articles using controlled vocabularies. At this point in the search development process, it's useful to test a search to see if you are missing relevant search terms and to see if it returns results appropriately. For biomedical topics, Bramer has frequently recommended starting with Embase and then moving to other databases such as PubMed. It's best practice for a systematic review to search multiple databases, though there is not a prescriptive number of databases. Bramer et al. In the 2017 article, Optimal Database Combinations for Literature Searches in Systematic Reviews, recommends searching in all of the following databases: Embase, Medline, Web of Science, and Google Scholar for a comprehensive search. Medline is a subset of journals that have been reviewed and selected based on their quality. You can find articles from Medline journals using the PubMed search engine. To filter for Medline content in PubMed, you will open PubMed, perform a search, and if Medline does not show up as a filter, you will click on Other and add the additional search filter for Medline. Cochrane, one of the main systematic review organizations, recommends searching in Central, Medline, and Embase. However, it should be noted that Central's focus is primarily on controlled trials. Through the rest of this video, we will focus on demonstrating how to develop the search for PubMed. However, for a comprehensive search, this process should be repeated for other databases in addition to PubMed. If you'd like to practice, go ahead and pause the video to add the Medline filter to PubMed. We also recommend making your personal PubMed account, officially called an NCBI account, so that you can see your search history and save searches more seamlessly. If you like, you can pause the video now to set up your account. Next, we will cover how to identify relevant thesaurus terms that are associated with a specific database platform. These terms are also called controlled vocabulary terms. PubMed has a thesaurus of MESH terms, and MESH stands for medical subject headings. You can explore this thesaurus by opening the MESH database on the PubMed website. These thesaurus terms are a specific list of words and phrases that are used to categorize articles. The staff, including subject experts that work for the database publisher, analyze the topics covered in articles and label them with thesaurus terms. Keep in mind, there might not be any highly relevant MESH terms associated with a particular concept. In this case, it's recommended to reach out to a health sciences librarian for their advice on MESH terms. To practice, pause this video and open the MESH database located on the bottom of the screen on the PubMed website. What is the most relevant MESH term for the concept colorectal cancer? So if you'd like to practice, go ahead and pause the video. So here I'm on PubMed and I'll scroll down, and under Explore, I'll click on MESH database and I'll search for colorectal cancer. Here I've searched for colorectal cancer in the MESH database. It shows me 15 results that it thinks that I'm looking for. So what you'll want to do is review this list to see, is there any one MESH term that's highly relevant? And in this case, I would say the first one seems relevant, so I'll click on that. And if you see a whole page like this one dedicated to one concept, so in this case, colorectal neoplasms, this means that colorectal neoplasms is a MESH term. And it's important to keep in mind that however it's written here at the top of the page is the exact MESH term that you should be searching for and take note of. So you'll notice on this page for colorectal neoplasms, it provides a definition. So underneath the definition, you'll see subheadings, and these options are here to narrow the search. So for example, I just clicked genetics, and if I were to actually perform this search, it would show me everything about the genetics of colorectal neoplasms. For a systematic review, we don't recommend using subheadings. Selecting Restrict to MESH Major Topic means that it will show you articles where colorectal neoplasms is the primary focus of the article. But again, we typically don't recommend this option for a systematic review. If I scroll down further, I'll see entry terms. For a systematic review, this list of entry terms can give you a sense of other ways that this topic might be phrased. If I scroll down even further, I'll see these concept trees. And essentially what you're looking for here is you're trying to identify if it makes sense to go more broad, meaning go further up the tree, or should you go more narrow, going down the tree. So it really is dependent upon your topic, whether or not you do that. But if we were interested in colorectal cancer, we would want to search for colorectal neoplasms. On this page, you can also just begin to search in PubMed for this MESH term. So you can click Add to Search Builder, and you can see it adds the exact phrase in quotation marks, and it includes a field code, MESH, in square brackets. And you can click Search PubMed, and it should show us everything categorized as being about colorectal neoplasms, which is over 200,000 results. The seed article approach is one where if you already have several highly relevant articles, ones that you think should be found when you perform the final search, you can identify additional synonyms and related terms from the titles and abstracts and author-supplied keywords. It's an evidence-based way to identify terms that the database uses that you know will return relevant articles. In this slide, we have a list of terms related to the Supplemental Nutrition Assistance Program. In this example, if we were specifically focusing on the SNAP program, we would want to add to our list Supplemental Nutrition Program, Supplemental Nutrition Assistance Program, the acronym SNAP, and food stamps. Depending on the scope of our research interest, it might be useful to also search for general terms like food assistance programs, food assistance and nutrition programs. Even broader than that, we might want to search for food insecurity or food spending. These decisions require discussion among the research team regarding the specific focus of the systematic review. You should not perform the actual systematic review search until you determine your true focus by examining concepts and their search terms in this level of detail. It is best practice to test out terms to determine if they return relevant results and to what degree. In this simple search term table for PubMed, we see that there are 3 mesh terms for 3 of our main concepts. When developing your table, be sure to take note which terms are subject headings so you remember them. Here, I have the mesh field codes, which are the letters MH enclosed in square brackets. In PubMed, you can search for MH or MESH inside square brackets, and they do the same thing. This code will essentially tell PubMed to search for this word or phrase as a subject heading. When it comes to thorough searching, it's best practice across databases to perform a search using both thesaurus terms, like mesh terms, as well as title and abstract terms. The field code for a title and abstract search in PubMed are the letters TIAB enclosed in square brackets. In this example, I would perform a search that tells PubMed to find articles with the phrase colorectal cancer in the titles and abstracts, or to find articles that are labeled with the mesh term colorectal neoplasms. If there were any other ways to phrase this topic, I would do a title and abstract search for all of those different ways at this point. The reason we perform both mesh and TIAB searches is because mesh terms help find relevant articles efficiently. However, we add the TIAB search because some articles in PubMed do not have any mesh terms associated with them. Doing both balances our needs to find relevant articles and to be comprehensive with our search. In the last several slides, we've shown how to identify and search for mesh terms in PubMed. Here in this table, the mesh terms are highlighted in yellow. It's best practice to also search for mesh words and phrases as TIAB searches. Any remaining words or phrases that are not mesh terms should also be searched using the TIAB field code. After identifying the thesaurus terms or mesh terms, you will want to account for variations in your search terms. In addition to synonyms and related terms, each database uses different characters that perform different functions in the search engine. On this slide, we can see how you can use the wildcard function in PubMed. For example, you can type VACCIN and add an asterisk. Performing this search will return articles with the word vaccine, vaccination, and any other variations of this word. Note that in PubMed, terms must have at least 4 characters before the first wildcard. To practice, how would you apply the wildcard function to the following list of words? Try performing the search using the wildcard function for this concept. Then perform a search for one of the words listed, such as metastasize. How do they compare in terms of number of results? Go ahead and pause the video to give it a try. Here is the way that you would apply the wildcard function. You would take out the least amount of letters at the end and find the base of the word that you would add the asterisk to. Notice there is no space between the last letter and the asterisk character. Here, I revised the previous search term table to apply the wildcards where appropriate. You'll notice that I added 1 in the middle of the word neighborhood to account for the British spelling of the word. After you add variations of your search terms, you will use database-appropriate syntax using parentheses, Boolean operators, and field codes, which we've briefly discussed. As a reminder, in PubMed, for mesh terms, you can use the drop-down menu in the advanced search to select mesh, or you can type in square brackets any of the following. All of these options do the same thing. They all tell PubMed to search for the word or phrase as a subject heading. For a keyword search in the titles and abstracts of articles, you will add the letters TIAB inside square brackets. Each database has unique field codes. Here is a table from the 2018 Bramer article showing various field codes for various database platforms. There are many field codes in PubMed. You can use the drop-down menu shown here to select a field to search in. For example, in PubMed, you could search for an author's name and select the author field code to make sure it's only searching for the word you type in as a name. When building the search, we use Boolean operators to control how the database performs the search. We will combine like terms or synonyms together with the Boolean operator OR. This is because we don't mind which synonym PubMed finds, we simply want it to find articles that discuss the concept overall. When we're finished combining synonyms together for each unique concept, we will put it all together and tell the database to find articles that discuss all of our essential concepts. We do this by combining concept clusters together with the Boolean operator AND. This creates a final search string. To apply this method, as an example, I will search for each term in the ADI column separately. So I will search for area of deprivation with TIAB field code. Then I will perform a new search for area deprivation index with the TIAB field code. Then I will perform a new search for neighborhood deprivation with the wildcard and the TIAB field code. I will then perform a new search to combine all three with the Boolean operator OR. I will repeat this process for concept or column number 2. I will again repeat this process for concept 3, column 3. Finally, I will combine the clusters together with AND because I want all articles to mention all three of the concepts. Let's practice. Keep in mind, this is an example search and not an actual list of exhaustive terms related to metastatic cancer and area deprivation index. To begin, open PubMed. Open the advanced search and clear your search history and any filters that you might have selected. Search for the following three terms separately, as shown. Using your search history, combine them together with the Boolean operator OR by clicking on the three dots next to terms in your search history. This search should show us all of the articles in PubMed about area deprivation index. Pause the video as needed. The benefit of starting with a spreadsheet or table is that you can copy and paste the search terms with the appropriate syntax straight into PubMed. So here I'm pasting area of deprivation with the TIAB field code into the query box in PubMed and clicking search. It shows me 49 articles with those words in the titles and abstracts. I can click advanced and then see my search history below. And if I'm ever wondering why did PubMed search this way, I can click on this caret or arrow and see a little bit of detail of how PubMed performed the search. And then I can also see my number of results on the right-hand side. So I can continue and paste the next term. So one option is to paste the keyword or phrase along with the field code straight into the query box. Another option is to type the word or phrase and choose the appropriate field code from the drop-down menu. So toward the bottom is title abstract. I can click add and you'll see that it adds the field code, a different variation of the field code, which does the same thing as TIAB. And then I can click search and it will find all articles that mention something related to neighborhood and deprivation, including various spellings of the word neighborhood. And you'll see I have over 1,000 articles. I can click advanced and then again, it will show up in my search history. So if we've been comprehensive with our search term table, we would have listed all of the variations of area deprivation here and performed those searches for those terms individually. So when we're finished with one of our columns, we will combine them together with the Boolean operator OR, and this is how you do it in PubMed. You'll add one of your searches back into the query box. So I'm clicking the three dots and clicking Add Query. And you'll see that it adds area of deprivation with the TIAB field code back into the query box. Then to add the next term, I will click the three dots and click Add with OR. And essentially what this code is telling PubMed to do is it's telling PubMed to find all articles that mention these phrases in the titles and abstracts. So I'll click search. And you'll see a combined total of almost 1,100 articles. And then I can click advanced and you'll see that that cluster for column number 1 is available for viewing in my search history. Repeat this process for your next concept in column 2. When you're finished performing this part of the search, you should see all of the articles that have a variation of the word metastatic in their titles or abstracts. Pause the video when necessary. Next, you'll want to perform the search for Concept 3, Column 3. So here I've added neoplasms as a subject heading, clicking Search. I'm adding neoplasms as a title and abstract search. And we see it in our search history. And you'll see there are different numbers of results, and this can give us a sense of why we're doing both mesh searches as well as title and abstract searches. And then I've added the final term, which is various spellings of the word cancer in titles and abstracts, and I'll click search. So what we want to do at this point is combine all of our cancer-related terms together. So I'm going to add 5, 6, and 7 together with or. The reason why I'm not including the metastatic term is because I specifically want all of the articles to mention something related to metastatic. And so that's why I'm separating it out. If I wasn't particularly interested in metastatic cancer, then I probably wouldn't include it in the search and I would just search for cancer-related terms. So here I'm adding number 5 back into the query box, adding number 6 with or, and adding number 7 with or, and that is going to create my cancer-related cluster. So I'll click search. Now click advanced to go back to my search history to see the results. And you can kind of compare how they performed based on the number of results. We'll see that neoplasms as a subject heading returned a little over 4 million results, but the TIAB searches captured more articles than just the subject heading, and the cluster search results provide evidence of that. So now that we have all of our search terms in our search history and we've combined them in a way that's conceptually logical, what we want to do is combine all 3 clusters together so that we're looking at our final search string. So in this case, search number 3 is our search related to area deprivation. So I'll add that to the box. Next, I want to add the word related to metastasize. So I'm going to add that, but this time I'm going to add it with and. And then finally, I'm going to add number 8, which is everything related to cancer. I'm going to click add with and. And this will essentially be our final search string. In previous examples, we searched for each word or phrase individually and used search history to build clusters of synonyms together. Here's another way to do this. You can build a search to cluster synonyms together by typing it out in a search string using parentheses as shown here. You might find this process confusing because it's easy to make mistakes using this method. However, you can choose a method that works best for you. Here we can see another example of how someone might combine terms with or and. Notice how in the final search string, there are parentheses around clusters of terms about a particular concept. The final search string at the bottom would essentially tell the database to find articles that mention either adolescents or teenagers or teens. We don't mind which one. And we also want those articles to mention either low-carb diet or Atkins diet or keto diet. We don't mind which one. And finally, the article should also mention diabetes. This is a simplified example that demonstrates Boolean operators generally, so you can see that there are no field codes. If we are actually searching for these concepts in a database, we would want to add the field codes. To summarize so far, we've completed building a search that would find articles that discuss all of our essential concepts. However, the next step in the search development process for a systematic review is to optimize the search. The most important question when performing a systematic search is whether all potentially relevant articles have been retrieved by the search strategy. This is also the most difficult question to answer, since it's unknown which and how many articles are relevant. It's therefore wise to broaden the search strategy and then check to see if new relevant results are found. A search strategy should be tested for completeness. Therefore, it is necessary to identify extra possibly relevant search terms and add them to the test search in an OR relationship with the already used search terms. A good place to start and a well-known strategy is scanning the top retrieved articles when sorted by relevance, looking for additional relevant synonyms that could be added to the search strategy. After optimizing the search, you will evaluate the initial article results. Bramer et al. In the 2018 article recommend evaluating initial results for relevance at this stage and recommend several approaches, including testing to see if your search returned known relevant articles your team found at the start of the project. After evaluating initial article results, you will then check for any errors. Bramer et al. State ideally search strategies should be checked by other information specialists. The Peer Review of Electronic Search Strategies, or PRESS, checklist offers good guidance for this process. Apart from the syntax, especially Boolean operators and field codes of the search strategy, it's wise to have the search terms checked by the clinician or researcher familiar with the topic. Peer review of the search strategy increases the quality of the search, minimizes errors in the design of the search strategy, and saves the research team time and money. So far, I've demonstrated how to build an effective search in one database. Because a systematic review needs to be comprehensive in its coverage, searches in other databases should be performed and will require translating or customizing the original search for other database platforms, as I mentioned previously. An example that I mentioned previously is that if you choose to search in Embase does not use mesh terms. Instead, they use another controlled vocabulary called Mtree terms. Embase also allows users to search with different field codes than PubMed. And all of this will need to be translated for each database you plan to search. The final step of developing the search is to test and revise it for accuracy. Bramer et al. State, ideally exhaustive search strategies should retrieve all references that are covered in a specific database. For systematic review search strategies, checking searches for their recall is advised. If additional papers have been identified through other non-database methods, such as checking references in included studies, results that were not identified by the database searches should be examined. If these results are available in the database but not located by the search strategy should be adapted to try to retrieve these results, as they may contain terms that were omitted in the original search strategies. In summary, the key takeaways for developing a systematic review search strategy are to develop exhaustive lists of search terms for each essential concept that must be discussed in all articles you hope to find. To be comprehensive and to avoid selection bias, you must search multiple databases. The search that you develop for one database will need to be translated to other database platforms to maintain consistency and to help you find relevant articles across database platforms. It is best practice to search for both subject headings as well as free text words in the titles and abstracts whenever possible. And finally, it's highly recommended that you work with a health sciences librarian to develop a systematic search strategy, because they are trained specifically on this topic. We have a team of librarians here at the Cleveland Health Sciences Library, and there are typically librarians on staff in hospitals as well that can assist with systematic reviews now and in the future.